Hi, my name's Leah Hechtman and I'm interviewing myself this round. Now, I wrote the fertility chapter for both men and women, and this is absolutely without doubt my clinical passion. I've been in practice for over 20 years and pretty much one of my first patients was a child. Now, when I was studying and I graduated, I was around 20, 21, and when I graduated, everyone was like, "You're going to specialise in paediatrics." I think it was probably because I was so young at the time as well. And I remember seeing that child with her parents and realising I have to start earlier than this. And so that's where it all started. And that's when I decided that I was going to dedicate my practice to helping people have the healthiest children that they possibly could and to be able to conceive in situations where they hadn't been able to in the past. Basically, on my clinical journey, I've expanded my knowledge base and my education consistently. So over every single year that I've been in practice, I've been doing some form of postgraduate training. At the moment, I'm finishing my very long PhD, but I'm finally at the end of that tunnel, thankfully. So I think that it's very important as clinicians that we continue to stay abreast of research and that we also continue to develop research. The development of research, I think, changes who we are as a clinician and helps us understand the science behind how we work, both as naturopaths and also naturopaths that are integrated into the wider fertility community. So in the chapter itself, I hope that you can see that there's a breadth of naturopathic content, both historical and current, but also there's a breadth of research in there, both from the mainstream medical community, the fertility-specific community, and the naturopathic community. And I think it's really important as clinicians that we're constantly abreast of that information, which is why I updated it so heavily, and that we use that information to both underpin how we practice, how we research, and how we develop our treatments, and also how we develop our networks. Because I think the more complicated the infertility patient that presents to us, the more our networks need to be expansive and inclusive. And I think it's naive of us to think that we're always going to have a patient that walks through our door that we can solely help. The more complicated a patient and the more complicated their condition and their presentation, the wider the network, the wider the team. And the longer I've been in practice, the more that team around me seems to help create those worlds for my patients. So I think both as you progress in your own practice, that you start to develop that network and develop that team in a way that's complementary to your services and in a way that supports your patients to achieve what they need to do. Any patient that's out there knows that a good clinician doesn't have a 100% track record, because otherwise they can't have seen all the cases that are out there. So of course, I haven't been able to help absolutely every single person that I've seen, but I've helped them indirectly if I haven't been able to help them directly, by referring them on or by developing a team of clinicians that are around them to create what it is that they're wanting to achieve. Every person that walks into my rooms, I say to them, you will be a mother or you will be a father. It just might not be the way that you intended. But hopefully, with this chapter, it will help more people with the way that they're intending to, using their own eggs or sperm or creating it from their own partnership. But sometimes we have to be supportive for the other variations of how you can make babies. Nonetheless, such a gift to be able to work in this area. I feel incredibly fortunate, and I feel incredibly fortunate that I've been able to do it for as long as I have, and that I can continue to do it for this long and for as long as I want to, basically. So I think that, what I'm hoping that you all gain from this chapter is a lot of knowledge, that you feel more informed about things that are around, and that it helps you to help other people to create the babies that they're wanting to. Thank you.